All right, this time I'd like to welcome in my guest, Dr.AnnaLembke, to the show. And she is the author of Dopamine Nation, which is an amazing book. If you have not had a chance to read it, I highly recommend you do. And as many of my clients know, I've already recommended it to them because it's a great read. So I appreciate you coming on and welcome to the show.
Thank you for inviting me.
Yeah. So for people that maybe have not read the book or have not heard about your work, Dr. Lembke, would you just mind just kind of telling us a little bit about yourself to start with and kind of, just how you got to where you're at with the book and a little bit about your career and stuff like that?
Sure. So I'm a psychiatrist. I did my medical training at Stanford, and then I stayed on and joined the faculty. Found myself somewhat accidentally treating patients with addictive disorders, and then got very interested in that. Felt that it was very purposeful work. Could really help my patients in ways I wasn't able to help them when I was essentially ignoring those problems, which is what I had been doing. And I've been doing that now for about 20 years. Dopamine Nation is essentially the culmination of my professional life, but also interwoven with the many important lessons I've personally learned from my patients in recovery.
Okay, great. Yeah. There's some great stories in there, and even talk a little bit about your own struggle with romance novels. Is that right? Is that?
Yeah, right. So the book opens with the case of a patient with a very serious sex and compulsive masturbation addiction, but it weaves that story with my own story of developing a minor addiction to escape fiction, primarily romance novels.
Mhm.
And what I'm trying to do there is really draw a parallel between people with, more severe addictions, including behavioral addictions, and the kinds of minor addictions that many of us have
Yeah.
now living in the modern world.
hmm Yeah, which I think is great because, like you said, I think a lot of people kind of minimize those things, but ultimately, when you look at them, they have that addictive component to it. It's just kind of a different form, or maybe doesn't feel as destructive, but still fits some of those parameters for sure as of escape or seeking kind of some kind of pleasure. So, okay, well, I wanted to kind of talk about some of the topics in the book. Initially, I mean, you have this conception of the pleasure pain balance that exists, I guess, in our brain and kind of like how that operates. Do you want to just talk a little bit about that and kind of how that goes for I guess all of us, right?
Yes. So, for me, one of the most exciting findings in neuroscience is that pleasure and pain are co-located in the brain, meaning that the same parts of the brain that process pleasure also process pain, and they work like opposite sides of a balance. So if you imagine a beam on a central fulcrum, something like a teeter-totter in a kid's playground, but when that teeter-totter's at rest, that beam is parallel with the ground. And that's what we call homeostasis. That is our baseline resting position. At that baseline position, we're firing dopamine at a constant tonic level. Dopamine is our pleasure neurotransmitter, which is released in a very specific region of the brain called the reward pathway. So we have evolved over millions of years of evolution to reflexively approach pleasure and avoid pain. And one of the ways that our brains get us to do that is to release dopamine in this reward pathway through this mechanism of akin to a pleasure pain balance. And I think it's really essential to understand how this balance works in order to appreciate sort of everyday experiences of reward, but also in particular to understand what happens in the brain as we become addicted. So essentially, when we do something pleasurable, we release dopamine, and that balance tilts slightly to the side of pleasure. But there are certain rules governing this balance. And the first and most important rule is the balance wants to remain level. And our brains will work very hard to restore a level balance after any deviation from neutrality. And our brains do that through a process called neuroadaptation. So no sooner have I released dopamine in response to, let's say, chocolate or a TikTok video or a romance novel or cannabis or alcohol or you name it, then my brain gets a signal that, oh, it's time to downregulate or stop making as much dopamine. It's time to take those dopamine receptors on the postsynaptic neuron and actually involute them so that I'm decreasing dopamine transmission. But the brain doesn't just decrease dopamine transmission to baseline levels. It actually goes below baseline into what is this dopamine deficit state. And I like to imagine that as these neuroadaptation gremlins hopping on the pain side of the balance to bring it level again, but they like it on the balance, so they stay on until the balance is tilted an equal and opposite amount to the side of pain. This is called the opponent process reaction, but it's also known as the hangover, the come down, the blue Monday, whatever you want to call it.
Mm-hmm.
And the
Yeah.
key piece of information here is that for every highly reinforcing, pleasurable experience, we pay a price. And that price is the come down or the after effect. That we don't get these pleasures for free, and that essentially the definition of biological stress is a deviation from neutrality. So we're also then releasing a lot of our adrenaline or our own stress hormone in response to any deviation as part of the cascade of molecular reactions that's working to bring us back to a level balance. That's not addiction, that's just how we restore neutrality. But the second rule of the balance, which is at the heart of compulsive overconsumption or addiction, is that with repeated exposure to the same or similar reinforcing stimulus, that initial deviation to pleasure gets weaker and shorter, but that after response to pain gets stronger and longer. In other words, the gremlins multiply, they get bigger and stronger. And so now we've got tolerance where I need more of my drug in greater quantities and or more potent forms to get the same effect. And those gremlins, by the way, once they're on the balance, they can take quite a lot of time to get off of the balance once they've become habituated to being there. So it's not just the immediate hangover or acute withdrawal. They persist there beyond that. And pretty soon, if I continue to use my drug of choice, now I've got gremlins camped out on the pain side of the balance, and I've essentially changed my hedonic or joy threshold such that I am walking around now with the balance tilted to the side of pain. Now I need my drug of choice, not to get high, but just to level the balance and feel normal. And when I'm not using, I'm experiencing the universal symptoms of withdrawal from any addictive substance, which are anxiety, irritability, insomnia, depression, and craving. And so now I'm using, again, not for pleasure, but just to stop feeling pain. And that then creates this vicious cycle of compulsion where I continue to ingest this substance or engage in this behavior as a way to get out of feeling bad. And this is essentially what drives the compulsive loop.
Right. So yeah, that was like one of the things I found interesting, just as far as like even the visual of it. I love the visual of the gremlins and kind of the teeter-totter and just kind of like the balance. But I think in the book, it just kind of, you give a brief description, like even just like going to have a cookie, you have a cookie, feels good. And then not even really thinking about it, that there's that, okay, now there's gremlins on the other side that balance that out, that kind of like, okay, now, you have to have something negative there to sort of balance that out to where now that's maybe why I want another cookie, because I want that.
Right.
I want to restore that feeling good.
That's right.
But it's already kind of gone back to a baseline. But obviously, like you just kind of shared, just the continuation of that, I guess, then leads to, which is something you talk about in the book too, just the broken balance, which is kind of what I think you just described as how that happens, right? The balance becomes broken as we continue to chase that feeling good, and then the system breaks down because it's out of sorts, and can put us in a difficult place, right?
Yeah, absolutely. That's right. Now, of course, with enough brain plasticity and enough abstinence, the gremlins will eventually hop off the pain side of the balance and homeostasis will be restored. The problem is that we live in this world of overwhelming overabundance where we have such easy access to our drug of choice and many other reinforcing substances and behaviors, so that with that temporary tilt to pain, we're inclined not to wait for the gremlins to hop off. We're inclined to reach for another cookie or another joint or another, glass of wine or whatever it is, another level of video game, another TikTok video.
Mhm.
And then it does temporarily make us feel better by getting us out of that pain situation. But the cumulative effect over time is to simply multiply the gremlins and sink us further into that chronic dopamine deficit state.
Right. And it's kind of in some sense, and I really, as I kind of went back over it last night and kind of some of the dynamics in the book and kind of like as a whole too, I mean, obviously that breakdown or that imbalance or breaking of the balance system can create its own sense of running from pain. But as a society, I mean, you talk about the book is just kind of how, as a whole, we seem to be doing that more so, and kind of just this tendency to kind of want run from pain in whatever form that pain is, whether it's, something difficult to face or whether it's a difficult feeling or emotion or whatever.
Right.
We've kind of fallen into that trap of just running from pain as a society. So what kind of speaks to you there, some of the things that you see as far as that goes?
Well, I mean, I think I try to begin out of a place of compassion for ourselves.
Mm-hmm.
This in the ways in which we chase pleasure and try to hide from pain, and the compassion, I'm able to access that by recognizing that on a neurobiological level, we really are wired to reflexively approach anything that's pleasurable and avoid anything that's painful.
Mm-hmm.
And the reason for that is because for most of human evolution, we've lived in a world of scarcity and ever-present danger. And what's kept us alive is that very reflex, right? And then you might ask yourself, well, why would Mother Nature make me pay for every pleasure by feeling pain afterwards? Well, that's a very smart mechanism if Mother Nature wants you to keep looking for the next berry bush or oasis or caribou or scarce mate in another tribe, right?
Yeah.
Because it's that pain and the gremlins on the pain side that create the craving for more. But, what's happened is that we've essentially transformed our ecosystem such that not only are we meeting our basic survival needs, but almost every human substance and behavior has been made more pleasurably reinforcing, more abundant, more potent, more accessible, such that we don't have to wait anymore. And we're now grabbing for that pleasure. And we've also constructed a sociological narrative around that, which is to say that, in fact, feeling pain in any form is not only painful, but it's the marker of some kind of disease state, that there's something actually wrong with you if you're in pain. Or maybe there's something wrong with your doctor because they're not giving you the pills you need to get out of pain. So it's fascinating how the environment that we have created has been created in lockstep with a cultural narrative that says pain is bad.
Mm-hmm.
And pleasure is what you need. And if you are experiencing any kind of physical pain or psychological suffering, there's something wrong with you. There's something wrong with your life. You need to change things, But of course, like every major philosophy and religious, teaching lets us know that life is painful, that it's full of suffering.
Mm-hmm.
But somehow we as modern people are trying to forget
Sidestep
that
that
wisdom. Yeah.
Yeah. Well, I think one of the things, and kind of even going into the book a little bit, and like when you talk about like that kind of relationship with pain, and even just the notion of like you just said, kind of going to your doctor, and if you're in pain, he must not be doing the right thing or giving me the right thing. But one of the things that you pointed out in the book too, just even like how today parents can be terrified of doing something or saying something that will leave their children in an emotional state of pain, right? So it's like we even like kind of have this sense of like, what am I doing or saying that could be, hurtful to them? And so I gotta literally treat them with kid gloves, like, in a more extensive kind of way. And we think, I guess, by society's norms or rules or whatever's happening, that we're doing them a favor, but we're also taking something away from them that is vital too. Any thoughts that you have with that, or things that you want? Yeah.
Yeah, I mean, exactly what I mean. We're essentially depriving our children of the opportunity to build up the mental calluses they need to be healthy, productive, adults. And much of that is an adulteration of early Freudian concepts. So Freud's great contribution was that we can have experiences in our childhood. In fact, we do have experiences in our childhood, conscious and unconscious, that shape us in our adult life, and that some of adult psychopathology can be traced back to early childhood experiences. But the modern day adulteration of that is that any kind of difficulty or distress or even challenge that a child experiences is essentially bad for them, is setting them up for ending up on a therapist's couch someday in the future, such that parents feel very trapped in this notion that, if their kid isn't happy all of the time, that somehow they're doing a bad job. And it's just so unfortunate, because of course, what kids really need is they need boundaries and they need structures. They need to learn, the difference between right and wrong. They need to, feel some degree of shame and guilt. And they need to, make right what they've done wrong,
Mhm.
and we can't always be their friend or in agreement with them. And we're harming them when we give them what they want all the time. So, but, many of us in this generation of parents, just terrified, and myself included at times, terrified to have my kids not like me or to be at odds with me, this kind of thing.
Yeah. Yeah. Definitely see lots of that in my practice. And like, even as a parent myself, I mean, you kind of, yeah, what can we do to make you feel better,
Right.
faster, whatever it is, versus like, oh, okay, this thing that you're going through might be of value. Maybe you
Hmm.
can't see that right now, but it definitely has the potential of having a value. And that kind of goes along with something you said in the book too, just like that, you know, we've lost the ability to tolerate or even mild forms of discomfort. And this isolation from pain makes pain worse. And that's the thing
Yes.
that I think that really stuck out to me, is just that, when we don't experience pain, then when we happen to experience pain just as a result of something, it's like it's harder to even experience or feel or even know what to do with, because it feels more overwhelming at that point,
Yeah,
because
we're
it's
like
like
little babies. We're like little soft-skinned babies, right? Like, oh, wait, this hurts.
right.
Yeah,
what
right.
what do I do with
Yeah,
that? So
what now?
I thought that was very
Mhm.
insightful as far as that goes, and just kind of like, that part of not wanting people to experience that, but then setting them up for something maybe worse because
Right.
they have no experience with pain. It's like, you know um the idea of losing something, like in a sport or whatever, but we're going to give you a trophy anyway. It's like to soften that a little bit or whatever. Maybe that's getting into my own whatever, but
No, I hear you. I know, and the corollary to that too is that when we do survive something very challenging, we can get a lot of confidence from that. In our just confidence in our ability to survive future struggles. It's like, well, I
Mhm,
made it through that. I came out the other side. I can do this, right?
mhm.
Whereas if you've never had that experience, you people have imposter syndrome. They don't believe in themselves on some very fundamental level.
Yeah, that's really a good point with that too. So as we kind of then look for like a solution to some of this, I know, like on a very, direct level, you talk about in the book, kind of like dopamine, fasting, and kind of 30 days away from stuff like that. But when it comes to the concept of like pressing on the pain side of things and kind of looking to that as a possible solution, do you want to talk a little bit about that and kind of what that concept is about as far as pressing on the pain side?
Sure. So this pleasure pain balance, it works in both directions, right?
Mhm.
We know when we press on the pleasure side with intoxicants or other reinforcing behaviors and drugs, that the gremlins hop on the pain side. But if we intentionally invite pain into our lives, physical pain, psychological pain, emotional pain, that is to say, we seek out things that are hard,
Mhm.
and we expose ourselves intentionally to hard things in mild to moderate doses, what we're effectively doing is pressing intentionally on the pain side of the balance as the initial stimulus, and thereby promoting those neuroadaptation gremlins to hop on the pleasure side, which is exactly what they do, staying on until the balance is tipped an equal and opposite amount to the side of pleasure. And this has been borne out in scientific experiments. For example, there's lots and lots of data showing that exercise is toxic to cells,
Mhm.
but we know exercise is good for us. So how does that work? Well,
Right.
what the body does in response to exercise, which is experienced as a form of mild injury, is that the body then starts to upregulate or increase our own feel-good hormones and neurotransmitters like dopamine. And there's lots of data showing that people, when they engage in exercise over the latter half of, let's say, an hour of exercise, will slowly begin to increase dopamine firing and dopamine levels. And the exciting news is that those dopamine levels will remain elevated for hours after the exercise is over, only going back down to baseline levels, hours later, without ever going into that deficit state, which is the state of craving and withdrawal. So that's great news, because it means that we can get our dopamine indirectly by paying for it up front. And then that's a better way to get our dopamine, because it means we don't go into this deficit state or this state of craving.
Okay.
Other examples are ice cold water plunges, but it doesn't need to be a physical thing per se. It can be, for example, getting to your long-awaited to-do list and getting that done, or having a difficult conversation, or meditation, or prayer. Any of these things that requires effortful engagement. The big caveat to all of this is you don't want to press on the pain side so hard and so fast that you essentially deplete the neurotransmitters, because then you get into a different kind of vicious cycle. So, for example, self-cutting is not the recommendation here. We
Right.
do release our endogenous endorphins in response to that injury, and that does release dopamine ultimately, but we also then deplete all of it, right? And then we don't have anything more for the subsequent times of cutting. Plus, it's just healthy and not adaptive to cut on yourself, because you're literally injuring your tissue, as opposed to these mild to moderate doses of toxic stimuli that are healthy for the organism.
Okay. And that's kind of like point that out in the book too, just like the idea that I guess like pushing on the pain side too much can create like a negative cycle that way. And also
Right.
like you kind of become addicted to that potentially, or whatever, kind of
Yeah.
like with cutting, right? Where people
Right.
kind of get addicted to that feeling that comes with that. So is that the notion of, if people were to read the book and like myself kind of like think about, like you talked about, if we can consume just the right amount of pain, we can discover this path to, is you say hormetic healing? Is that what it's
Yeah.
is
So
that what it's called?
hormesis, the
Or,
science of hormesis is
mm-hmm,
from the Greek word uh, to set in motion. And essentially what we're doing, and there are lots of animal experiments showing this, when you expose an animal to various forms of mild to moderate toxic stimuli, you make the animal more resilient. They live longer, they're more agile, they can
mm-hmm,
withstand, other toxins. So there's a lot of science showing that hardship and pain in various forms is good for the organism. I want to emphasize here that this kind of notion of embracing hard things or asceticism is more necessary now, because we live in this world of overwhelming overabundance, in which we don't even need to get up off the couch and can get food and can get sort of all of these stimulants. And so in that kind of world, I think we need to be more intentional about inviting hard things into our lives. So this isn't about like wearing a hair shirt or flogging yourself or something, or,
Yeah.
taking this to some extreme. What this is saying, or what I'm trying to say, I should say,
Mhm.
is that we live in a world of overwhelming overabundance, such that we actually have to think in advance about doing the difficult thing, because the world is presenting us on a silver platter uh, too many good things. One of the examples that I like to use is when you're watching Netflix shows and they come in these series. And at the end of the show, of course, there's a craving and a desire to watch the next show. But we don't even have to reach out our hand to press next episode in order to watch the next show. It automatically comes on with that little button in the lower right corner, and you see it move to next episode, so that you actually have to move your hand to stop getting the next episode. And that is just a great metaphor for like everything now,
Mhm.
which is why I think, again, in thinking in advance about intentionally doing things that are inconvenient, or doing it in an inconvenient way, right?
Yeah.
In the way that's a little bit harder, is so necessary.
Right. No, that's great. And I think that goes along with something you also said in the book, is just this pursuit of pain is harder than pursuing pleasure, partly because it goes against our innate reflex to avoid pain. And then you add that with, like you said, that's a perfect example where it's like this notion to just, enjoy stuff for what it is. And it's like, oh yeah, it's going to just go to the next episode. Yeah, we'll just do one more episode, as opposed to
Mhm.
like reaching for the remote or whatever. Even in that simplistic thing, it's such a draw.
Right.
Um, so I'm curious about this because obviously I see clients. I'm assuming, do you still see clients
Oh
then?
yeah.
Okay, okay, great.
Yeah.
It's always, yeah. I don't think I'd ever want to not see clients.
Yeah.
So I'm curious, how has that changed some of your approach with them? Like, as far as, like you said, getting them to be more intentional, or what kind of things does that look like for you as a therapist with your clients to kind of help them to press on the pain side?
Well, first of all, I have many patients who come to see me for depression and anxiety, and then I just happen to discover in screening that they're using cannabis or alcohol or pornography or video games or social media.
Mhm.
20 years ago, the first thing I would have done was give them an antidepressant for their depression or anxiety. Today, the first thing I will often do is ask them first to abstain from their drug of choice for long enough to reset reward pathways. The
Mhm.
hypothesis being that that alone may get them out of depression and anxiety, that in fact, what's driving their depression and anxiety is the ways in which we're bombarding our reward pathway with these constant hits of dopamine. So that's right there. I'm asking them to do a hard thing,
Okay, yeah,
which
that's
is
true.
give up
Yes. Give up
their
their
drug of choice, which
mhm.
is very hard, because initially that balance, you know, tips hard and fast to the side of pain when it's unopposed by the drug of choice with all those gremlins hanging
Right.
out on that side.
Yeah, yeah.
But the other thing I do absolutely is I will ask people to, when they're feeling craving or they're feeling sadness, do something that's more painful than the sadness of that feeling in the moment. So go for a run, go for a walk, do 25 sit-ups, reach out to a friend, read a difficult text. I think mind-body work is really important because we're so sedentary now, so detached from our bodies. Dopamine is also fundamental to movement. So I really like to use movement whenever possible and ask people to, move your body in a way that, is hard and that you don't want to do, but which I think will be fundamental to getting you feeling better.
Mhm. Okay, great, great. And do you, I mean, like you mentioned in the book about like parents and stuff like that, do you work with that clientele as far as parents coming in with their kids? Is it more like
Mm.
do you work with them?
Oh, yeah,
Yeah,
yeah.
okay.
So a lot of um, helping parents to try to tolerate the anxiety that we feel when we are not rushing in to help our children, right?
Mhm.
Or even potentially letting them crash, right? In some way. I mean, what happens is with parenting today, we actually in a funny kind of way get addicted to our kids. and in a codependent way get addicted to their well-being, and we lose sight of what is actually good for them. So getting parents to withdraw some of that codependent helping that's not actually helping their kids, and to tolerate the mounting anxiety they will feel. And there's a lot of distress with that when, you're used to kind of swooping in and doing everything.
Right. Yeah, for sure. And that's a good way to say it too. It's like ultimately you're just helping them to manage that anxiety that goes along with that.
Right.
And if they can do that, allow for that space for them, if the kids to get that work in, it can be great for both parties involved, right?
Right. I mean, I think what people need to do, whether it's giving up their own drug of choice or a parent, helping, or actually a parent not helping the child, letting the child just have their experience, is to go through the full cycle of that mounting anxiety, but then watching it dissipate, and then being able to see how you can come out the other side of that and not feel the same compulsion to act in that repetitive way, but also see what that life unfolds and that good things can come of that. And once people have gone through that cycle, then I don't have to persuade them anymore. They've done it for themselves. That's why I like to conceptualize this as like an experiment. It's like, oh, what's working for you is what you're doing now is not working. Let's try an experiment. Try something different.
Yeah. Well, and even in that kind of words, I'm sure for people, it's like, okay, it's an experiment. So if it doesn't work, we'll do something else. So that you get them kind of to buy in, whether like, oh, this is something you have to do for the rest of your life. It's like more like, hey, here's an experiment. We'll try it out.
Yeah, here's a hypothesis. Here's the experiment that goes with it, cycle through and see what you think.
Yeah, it's great. So the last thing I want to just touch on in the time we have. So at the end of the chapter, you also talk about this concept of radical honesty and the role that it plays in recovery, I guess, through addiction, but also in this whole process of the dopamine aspect of things. So do you want to just kind of, I guess, how did you come about the radical honesty, or where did that
so this is something that I very much learned from patients in long-term recovery. A consistent theme in that population was that people in good recovery almost universally had landed on the truism for them that they couldn't lie, and that if they started to lie, they would probably relapse. But what was interesting about this is that it's not just that they couldn't lie about use. They couldn't lie about anything, even seemingly trivial or insignificant lies not related to their addiction, what would put them at risk for relapse. And that's what I ended up calling radical honesty, when we really actively engage in the project of not lying about anything. Like, so for example, not lying about why we were 5 minutes late to a meeting, right? Not saying, oh, sorry, traffic was bad, when the truth is that we just wanted 5 more minutes to read the paper and drink our coffee. And this became really interesting to me, this concept of radical honesty and why that might help people in recovery, and whether or not it might help all of us, struggling in this world. And I really have become convinced that it's a very good tool for enhancing well-being and improving quality of life. And it works on a lot of different levels. First of all, I think it's important to acknowledge that telling the truth is hard, and the average adult tells 1 to 2 small lies per day, not even really realizing they're doing so. So that in order to tell the truth, we actually need to intentionally and in advance monitor ourselves, because we're all so prone to tell these little lies, especially lies that cover up our own selfishness or mistakes, things like that. So the level that it works on is really fascinating. I think one of the levels that it works on is that it probably, actively telling the truth probably stimulates the prefrontal cortex. And the prefrontal cortex is this big gray matter area right behind our foreheads that's so important for delaying gratification, for autobiographical storytelling, for appreciating future consequences. So I talk in the book about this experiment that was done, in which individuals engaged in a die rolling task and they could win a reward, and almost everybody lied about the outcomes to win the reward. But when a transcranial magnetic stimulator was used on their prefrontal cortex to stimulate that area, they tended to lie less, which is interesting. It suggests that prefrontal cortical stimulation decreases lying, which led me to wonder, well, does then truth telling actually activate the prefrontal cortex? And it very well may do that. And in activating the prefrontal cortex may allow us to better appreciate future consequences, of our actions, as well as delay gratification. The other level on which radical truth telling works is that it allows for true intimacy. So we think that when we tell people, what we've really done, that they'll go running from us because of the awful person that we are. But in truth, the opposite happens, and people see in us their own brokenness and vulnerability, and they feel closer to us. And that then allows for this explosion of intimacy, which of course releases feel-good neurotransmitters like dopamine. So there's this very paradoxical way in which we're so afraid to tell the truth, especially to people that we care about, because we're afraid it will rupture the relationship, when what it really does is it strengthens the relationship. And of course, one of the big projects in recovery from addiction is rebuilding that trust that's been lost through all the lying that accompanies addiction. So those are just, two of the ways. I think the other important way, I list multiple ways that truth telling helps, is that it creates also an abundance mindset, even amidst scarcity, as opposed to a scarcity mindset, which can occur even in abundance. And there's this great example from the Stanford marshmallow experiment, where kids were asked to, they were given a marshmallow and told, well, if you cannot eat it for 15 minutes, you get a second marshmallow. And then they kind of looked at the differing abilities among children to do that. But then there was a little known sort of riff or variation on their experiment, where half of the kids were told, okay, wait 15 minutes and you can get a second marshmallow. But in the interim, if you ring this bell, if you have a question or something, we'll come back. And in half of that group, when the kids rang the bell, the researcher came back, and the other half, the researcher didn't come back. And so essentially the kids were lied to. And in the group where the kids were lied to, they were much more likely to eat the first marshmallow and not be able to wait. In other words, when people lie to each other, it engenders this sense of scarcity, which then puts people in survival mode, where they are not going to be able to delay gratification. Whereas if people feel like they can trust others, and that the world is a space where people tell the truth, then it engenders a plenty mindset, where people feel like, oh, it's okay, I can wait on this marshmallow, and I can wait for some other reward that might come out of it. So those are just some thoughts.
Yeah, that's interesting too. Just as you were sitting there thinking, I also wondered if that relates to because I work with a lot of couples, and through the addiction, like I said, rebuilding trust is a big part of that. I also wonder if the truth telling aspect, what that conveys to the other person, or gives them the sense when you give that to them, when the addict might give that to their spouse or partner or whatever,
right,
that it gives them that sense of okay, I can kind of wait, I can be more patient, I can be more accepting and forgiving, because I'm getting this truth, rather than obviously when they're not getting the truth, that it definitely doesn't give them that state of being. And there's a harder sense of how do I trust, or how do I wait, or how do I even give you empathy during this process? Because, I'm not getting the thing that really, feeds that in me, which is, simply, but yet, effectively the truth. Right. So
yes, exactly.
Yeah. And I think, from the other standpoint, like you mentioned, how it mitigates the emotional experience of shame, and helps us to even, stop or reduce the shameful behavior in ourselves as we do that. It just, like you said, I think it really just comes down to truth telling is hard, but like we've been talking about, with hard things comes a different type of dopamine, or a different type of payoff that's more enduring or long lasting. It's just getting people to buy into that, that mindset, right?
Yes, that's right. Yeah. Or having the courage. It takes a lot of courage to try it out, and then see how the cycle goes, and how it's so much better.
Right. Yeah. Well, there's lots of great things in the book. I mean, I think even though we did a little brief synopsis of some of the chapters, there's still wonderful nuggets in there for people to read. So I know, like I said, every person I've given it to or recommended it for, they've just loved it. So I really appreciate your work and what you've done with the book, and bringing awareness to some of these important things, especially, like I said, in this kind of saturated pleasureful society that we live in. We
Right.
definitely need to start to balance out the other side and work towards, you know, I guess just incorporating more challenging things as a way of dealing with life. And that's kind of what life is supposed to be, is difficult things. But, society's just, it's given us a lot of easy way out, but
Yes, it's in many ways a much more challenging world to live in, and I think the stress of abundance is underappreciated.
yeah. Well, thank you again, Dr. Lembke,
You're
and I
very
really
welcome.
appreciate your time. Yeah.
Thanks for having me.
Yeah.
It was a pleasure.
Yeah.